Hey guys, I got a special guest today, Dr. Adel Eldin. He's been in private practice in Florida for over 20 years. He's a board certified cardiologist. His work is known nationally for patient advocacy, senior rights, education, and community outreach. He is proud recipient of many prestigious awards involving the Best Small Business of the Year, First Humanitarian Award, and special recognition from President Obama for serving the community, to name a few. Dr. Eldin is an entrepreneur who has been working on solutions for the healthcare crisis involving low cost, quality healthcare model, and also founded Florida Medical Tourism in spring of 2012 to help ease the global healthcare needs and always putting patients first. He speaks locally and internationally with putting an emphasis on bringing the heart back into medicine. Doc, welcome on the show. We're excited to have you.
Thank you so much for having me.
How are you doing today?
Wonderful.
Awesome. So how'd you get into cardiologist? How did you decide to get into that?
This is a long story, but basically I always been fascinated by the heart, and ironically, it attracted me more than anything else. I always want to be a doctor, but which kind of doctor, which way to go? So cardiology has always been a fascinating field to me. And, so I got an early start with a lot of research and basically attending late rounds, grand rounds, case reviews, and with all that had to do with the angiography, the cardiac cath, and it was really got me more into the field. So I kind of in the initial training during the internship and residency, I put all my electives into cardiology, and I dedicated some time into research, and I even had a 1 year fully dedicated to the clinical research in various aspects of cardiology, including something called local drug delivery. We're talking about the early 90s, and this was the preload of getting the stents. That's what you know now, that metal mesh that keeps the artery open, that treats blockage, the kind of state of the art. So this is all come from the work that I was part of. It's called local drug delivery, where we know that something called angioplasty, just when people blow up a balloon into the blocked arteries, and it helped with the getting the blood flow established. But the problem is, after 6 months, within the first 6 months after the intervention, the blockage can come back, and symptoms can come back with chest pain and so on. So that was Achilles tendon of how this blockage could be fixed. So there has been many ways to approach this phenomenon with you go and shave the plaque, cook the plaque with heat and thermal angioplasty, or drill through it, especially with the calcified plaque, with the rotational atherectomy. All these are been different approaches of how to conquer the plaque. But the only one that really worked is the scaffolding effect of the stents. And then if you have a drug coating of the stents, that will inhibit the cell replication. It's like almost localized cancer that happened at the treated site, to prevent this blockage from coming back. And bingo, all the trials that across the Atlantic matched data over the US and over in Europe, and showed a consistent data of remarkable impact of the stents on the patency of the arteries, on symptoms, on much less need for re-intervention, and so on and so forth. So I was very intrigued during this, early, trials that got the FDA approval into getting the stents to be treated in people who have coronary disease here in the United States in '94, and that was a landmark event that got this exciting world. Now we're into maybe the fifth or sixth generation of drug-coated stents that's smaller, that has much better trackability, that can basically be deployed in arteries that could be at a bend, or it have some calcification, or it has also ability to be visible and seen rather than getting lost, which happened in the initial stent. So there's a lot of great stuff that happened since then, and I'm very glad that I was a part of that, along with all the transition from the club busting trials that we used to do for acute heart attacks into the stent, into the heart attack therapy. So
yeah, that's absolutely incredible. That's absolutely incredible. So so now we know how you got there, and then what got you to do go off on your own and do your own private practice and be entrepreneurial in that regard?
Yeah, for 23 years now, I've been serving Tampa Bay area. I believe that I always enjoyed and independence and ability to have effective operation that way to help my patients and to be able to make the right decision for their management and so on, rather than kind of being told what to do and so on, and may not be in the best interest of patients' care. And this is how kind of navigated through the initial part, and everything was great till basically the first world economic crisis that happened back in 2009, and that was a transformational time for me.
And what happened with that?
I knew that I'm usually 10 years ahead, so I knew that healthcare has got to change. There is no way that the current system will continue, because healthcare is a huge part of the economy and the system of acute care. And you just kind of go, you get sick, you go to the hospital, you get a spot fix, and then you go out. It's called sick care. Will not be able to basically be sustainable. Same thing to the payment, same thing for reimbursement, same thing for the way that we approach. And then when we compared US healthcare data compared to the rest of the world, we're number 38. We're the big spender in the world money wise for healthcare, but 38 in ranking in terms of healthcare criteria. So,
and what's the major, like, where are we at now, and then what did you come in and want to change?
Sure. I wanted to, number one, be able to take care of my patients without spending half of the day worrying about the patient in showing up in my office, and I cannot see, sitting in my waiting room, I cannot see because there's no pre-authorization for me to see the patient, especially in so many other bureaucracy that have basically drained the staff and everybody dealing with this situation. And of course the payment, non-payments and delayed payments and minuscule payments, all these things for service have been delivered in good faith, and then you have to get denial and delay, all that stuff through the third party after having 40% of your daily time and effort just chasing paperwork and so on. So that led to 80% burnout of physicians here in the US. And I figured, well, I'm thinking solutions now. Because things are just getting worse for the consumer and things are getting worse for the provider. So I figured, why we go back the old fashioned way, direct contracting for healthcare. Us and the patient directly, me and the patient, who know me and know the quality and trust, because that's a huge impact. And then we could prove also that we could save them. Now we have in our model $7,000 to $10,000 per person per year. I started first after 2 years of research and development, putting it together. It was a low-cost quality healthcare program. We started also in the city of Tampa, having for the non-Medicare retirees for 3 years in a row, being offered as an option for basically the firefighters and cops to have a choice if they want to do that. And then designed a very unrivaled prices that is incredible saving. Like I said, $7,000 to $10,000 per person per year compared to what they were doing in traditional way of coverage, and then zero out-of-pocket cost.
Really?
Yes, no co-payments, no deductibles, no pre-authorization, no denial pre-existing condition, because that was a huge issue also for a lot of my patients. And no referral necessary. People can just go the old-fashioned way, and then can come and enroll and be treated. And then I made it also age-specific. So no one size fits all. Of course, the older the patient get, there's a little bit of increase, but the prices are all incredible. And then I also worked with the legislature at the same time, going to Tallahassee, presenting in the healthcare for subcommittee, and really offer people for small and medium-sized businesses, because they could not sustain the cost of healthcare for their employees and so on. And if they want to retain some good employees, then they can't. So they lose the good employees because of failure, inability to afford coverage for them. So that's where go ahead.
Yeah, I was going to say that's amazing. And what inspired you to really do, I get that there's people solving pain, but one of the biggest distinctions that I like that you did is that you looked for the solution. A lot of people will sit there and complain, and one of the biggest things is focusing on the solution, not the problem. So I think that's amazing. Yeah, it
hasn't been easy, Jordan. It's been a very, very challenging, tough roads. I know it's not something at the time was popular, that changes status quo and so on, and offer people some sort of a different pathway for their healthcare needs. And, I had a lot of challenging, issues and so on and so forth. And I went and I had so many community educational events just to let them know what's out there. Those who cannot afford the traditional route of coverage, and then offer them some alternatives. And again, working with legislature, I'm very proud State Representative Danny Burgess was one of the heroes that I've been working with. And you try once and it didn't go through, twice, three times, but kept trying till finally in 2018, on March 23rd, the Governor Scott signed it into law, the direct contracting for healthcare. Direct primary care as alternative, mainstream option to folks if they wanted to do it, rather than going through the traditional insurance, because of all the complaints and things that people could not afford it, and denials and this and that. So that's when the transition have taken care into Prontocare at that point in time, to offer people that really historic achievement in the state of Florida that I'm so proud to be part of.
Absolutely. So at this point in the state of Florida, anybody who's interested could use this service, or no?
Yes, actually, the challenges never stop. So after that, of course, you had to kind of you get that new look, if you would, with Prontocare, but
Yeah,
getting kind of transformational changes, and
yeah,
this was going back to 2019, after starting Prontocare 2018 as a continuation of Brooksville Cardiology, which was the previous 20 years. Then we had to come across unfortunately COVID pandemic that
of
have
course.
changed everything. And now people, because of concerns about getting infection and travel and this and that, the face-to-face physical approach has been a challenge. So again, that was a big I would say you always look at a challenge as an opportunity. That's why I'll try to get the positive end of it rather than getting the negative part of it. And we said, okay, well, that will open the doors now to really go into telemedicine and try to really reach out. Then anyone in Florida or beyond, looking for pronto care services or want to be enrolled and have take advantage, simply because in Florida it's very unique that we have millions and millions of people, not just in Tampa Bay area, that are snowbirds, that they come and maybe stick around for the winter months,
Yeah,
from New York and Jersey and so on, and other parts of the nation. When it's cold, that they come here and spend 6 months or so that they could have this one encounter, which could be physical, but then once it's established and patient established, then after that, everything could be done online and done and through phones and videos and other things that will make things for the patient so easy to be able to get their care in a convenient way. They already established the relationship. We already have the trust factor built. We already know that we're advocating for our patients. And now we really also transform the healthcare into disease prevention, wellness, and prevention of going for people to go into this acute fixing of the problem, and then sending out and not really doing anything. So they're going to come back and back and back. Well, maybe that was something from the past, but now I believe we tell people what to eat, how to eat, healthy, stay away from bad habits, uplift them, especially with COVID, stresses and challenges, long list of things. So we try to support them in every possible way.
yeah,
So
a
there's
holistic view.
work in progress. Huh?
Yeah, I was saying a holistic view, like being proactive with it, making sure that people are in the right direction. So I guess I know your time's short. I guess one last thing that I'd be interested in is obviously you're a cardiologist. So what are some things that the general public could do to be proactive about their heart, their care?
Very good, very good. I will, the answer is not stents. I'm just saying that now there are a couple of trials that have really changed the landscape of the way that we're thinking. It's called Courage trial. Back in 2007, was published in New England Journal of Medicine, and then the other trials came and confirmed those findings. Medical therapy versus stents, the same outcome for chronic stable coronary artery disease. So now we have to really rethink the way we're doing things. It's not always going to be the mechanical intervention, but it's going to be how to change diet, how to change lifestyle, by more exercise, by more relaxation, and get rid of the bad habits, smoking, alcohol, vaping, hookah, all the toxins, even the high energy drinks for young folks now lead to heart failure.
Oh, wow.
So, and unless and until people take care of their immune health, yeah, and that's going to be the key to prevent people from getting infection with coronavirus and other infection, because unless you have a strong immune system, that is you know going to be the key factor for not only survival but also for quality of life and chronic diseases, which constitute 90% or more of the healthcare. And I know people think, well, vaccine, maybe it's a good thing, but it is not the whole story, because people can still get infected with coronavirus even if they got the vaccine, if their immune system is weakened. So tell people to keep away from the toxins, eat fresh fruits and vegetables, stay away from processed meats, stay away from the things that yet will harm you. Excessive energy drinks. This is definitely going to harm a lot of young people in particular, because they really think that, okay, I got vaccinated, I'm home free. So that is a transformation in the way we think. Don't wait for a problem to happen, but be ahead and be proactive in your own health, which is really more important than wealth. That is your most important commodity right now, is your health.
Absolutely. And I think I really enjoyed how you made it so simple. It's exercise, eating healthy foods, which aren't processed meats, vegetables, fruits, and being on top of your immune system and being proactive. So I love that.
And stay away from toxins.
Oh yeah, no toxins, no alcohol, no alcohol, no smoking, no vaping, all that. Be aware of it, be conscious of it, make the decision for yourself.
Very good.
And so the last thing, where can people learn more about Prontocare and learn more about what you're doing? And if they're interested, how do they get involved or reach you? And yeah.
I made it very, very simple for consumers, because this is really what my passion is, how anybody is looking for help and so on. Just go to www.prontocare, one word, PRONTOCARE.co, not .com, .co. And then you go and based on your age group, you can read the contract. I made it very simple, plain English. Actually English and in Arabic, for folks who wants to know about it and read it. If you like it, you can just go ahead and go to PayPal, you enroll. And once you enroll, then you can basically, call to make an appointment, and then we'll see you. Like I said, it's needed just once to kind of establish physical exam and a relationship, but then after that, everything else could be done remotely, on telemedicine or phone or video, or other ways that people, when even travel all across the U.S., as long as they're part of the Prontocare. Now you see this with the snowbirds and others. Someone came here and then been established. They go to Alaska, they have something, and they do take care of it, and then they go to visit their grandkids in Chicago, and they get a red eye, so we could so there's a lot of things that we helped thousands, literally thousands of patients to save them money, which is a big issue right now with the economic downturn, that coupled with coronavirus and loss of jobs and income. I feel for people and I help them. And there's two more important aspects of Prontocare that I want to share with you before I go. That's really very unique. Number one, you are the owner of your data. Nobody's going to share that data with anyone without your permission. And in this way, nobody can sell it and make money out of it, or violate the privacy or anything like that. So that's very important factor to protect your data. And then Number two, we also help the community. So we give 5% back to help basically fight hunger, because we have 65 million hungry American women, children, seniors, and veterans. So this is one way that we bring the heart back in medicine, help the community, and also fight not just disease and hunger, but also fight crime in the community, just by giving the food back and helping people. And we were very proud to get involved in many projects, basically delivering tens of thousands of meals, and we'll continue to do that. We just want people to be aware that there's a simple option, a very affordable, a very top quality option, and now we're trying to make it also very high tech and accessible from your phone anywhere you may happen to be with prontocare.co.
Awesome. And I'll definitely have that in the link. And it's been awesome, Doc. I appreciate you coming on. I think this has really been informative, and thank you.
I appreciate the opportunity. Thank you.